Uh, if you are dissatisfied with your breast size, augmentation surgery is a choice to consider. This very safe procedure increases fullness and projection of the breasts, improve the balance of your figure, and enhance your self-image and self-confidence. This procedure involves using implants to fulfill your desire for fuller breasts or to restore breast volume loss after weight reduction or pregnancy. Breast augmentation can be performed after your breasts are fully developed and it does not interfere with the pregnancy. Breast augmentation does not correct severely dropping breasts. A breast lift should be considered in such a case. I prefer to operate the patient under. If you are dissatisfied with your breast size, augmentation surgery is a choice to consider. This very safe procedure increases fullness and projection of your breasts, improve the balance of your figure, enhance your self-image and self-confidence. This procedure involves using implants to fulfill your desire for fuller breasts or to restore breast volume loss after weight reduction or pregnancy. Breast augmentation can be performed after your breasts are fully developed. It does not interfere with the pregnancy. It's not recommended for the severely dropping breasts. A breast lift should be considered in such a case. I prefer to operate the patients under general anesthesia. Normally, the patient can be discharged 3 to 4 hours after the operation, but I prefer to keep the patient in the hospital overnight if they come to Istanbul alone and plan to go back to the hotel. There are 2 incisions I usually recommend to my patients. An inframammary incision is advised for the relatively young patients, and a periareolar incision for the patients who want this type of incision, or if a breast lift is also desired. Transaxillary and periumbilical incisions restrict the choice of the implant. For this reason, I usually do not use those incisions. Implant type and size will be determined not just on your desired increase in size, but more importantly on your breast anatomy, skin elasticity, and body type. My choice of implant type is silicone implants which are filled with an elastic gel. I do not recommend saline-filled implants or autologous fat transplantation for the breast augmentation. After the incision is made, a breast implant is inserted into a pocket either under the pectoral muscle, which is a submuscular placement, and I prefer this type of placement, especially for the young patients and for the teen patients, or directly behind the breast tissue over the pectoral muscle, which is a submammary or subglandular placement. The method for inserting and positioning implants depends on the type of the implant, degree of enlargement desired, your body type, and your surgeon's recommendations. After this kind of operation, the patients can fly back to their countries 6 days after the operation.